Hi, my name is Courtney Millington. I'm an F&P student at the University of Memphis. It is August 19th, 2022, and this is my head-to-toe video for the fall semester of 2022. I'm going to start by doing a scan of the room. So here is my table with all of my tools. Here is the first wall, another wall. This is Margaret videoing, another wall. Another wall, and then Emily the patient, and this is the ceiling. Okay, and we'll get started. Hi, Miss Emily. My name's Courtney. I'm going to be your nurse practitioner completing a head-to-toe assessment today on you. I'm going to wash my hands. I'm going to first start by assessing the skin, just looking at the overall color. I'm going to look at the head, the face, the neck, the anterior and posterior chest. I'm looking that the color is consistent with ethnicity. It is warm and dry to touch. Skin turgor is elastic. I'm looking for edema. I'm looking for any scarring, any bruises, any lesions, nevi, deformities, any masses. I'm going to look at her head. It is normocephalic, symmetric, in midline position. I'm going to then palpate her scalp. Hair is evenly distributed. It is coarse and brown. I'm palpating for any masses, any tenderness. I'm looking for any infestations, any lesions, any depressions, infestations, no tenderness up here. I'm going to palpate your temporal arteries, and then the lymph nodes, so preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I'm going to palpate her TMJ, so just open and clench your jaw. I'm assessing for any subluxation, tenderness, or crepitus there. I'm then going to assess cranial nerve number 5, so over the master muscle, just open and clenching that jaw again. And I'm also going to assess light touch sensations, so just close your eyes and let me know where I touch.
Forehead, cheek, chin, nose.
Good. And then cranial nerve number 7 for facial symmetry, so just close your eyes, open them, raise your eyebrows, puff your cheeks out. Good, and then puck your lips, and then smile with your teeth. Very good. I'm then going to move on to her ears, so I'm first just looking at the shape, the position. I'm going to palpate the pinna and the tragus for any masses or tenderness. I am going to assess the auditory canals and the tympanic membranes. And the auditory canals and the tympanic membranes are without redness. Tympanic membranes are pearly gray with a visible kind of light bilaterally. I'm going to assess cranial nerve number 8 with the Whisper, Weber, and Rhine test. So if you could just close this ear and let me know what a whisper.
Apple.
Good, and then this one. Back. Perfect. I'm then going to strike this and place it on top of your head and just let me know if you hear it equal bilaterally on one side greater than the other.
Equal.
Perfect. And then I'm going to place it on the back and then on the side, and you just let me know when you hear it stop.
Stop. Stop. Stop. Stop.
Good. So air conduction is greater than bone conduction. And then moving on to her eyes, first just looking that her eyelashes are pointing away from her eyes, her eyebrows, and the palpebral fissures. I'm looking at the sclera and the conjunctiva. Sclera is white, the conjunctiva is moist and pink. I'm going to assess cranial nerve number 2, which is gross visual acuity, as well as peripheral and central vision. So just standing back with the Snellen chart, and if you could read the smallest sign possible.
CFDHJ.
Close one eye and read it again.
CFDHJ.
And the other.
CFDHJ.
Perfect. So she has 20/25 vision in both left and right eye. And then just let me know when you can see my fingers.
Yes. Yes.
Perfect. And then I'm going to assess cranial nerve number 3, which is direct and consensual pupillary response to light. So just look straight ahead. Perfect. And so next I'm going to do accommodation and convergence. So just looking ahead and follow my finger in towards your nose and then out. Good. And then cranial nerve 3, 4, and 6 with EOM. So keeping your head straight and follow my finger with your eyes. And then I'm going to lastly just look for the red light reflex as well as all other internal eye structures. Good. Okay, next I'm going to move on to her nose. It is straight, it is midline position. I'm going to assess cranial nerve number 1 since it's smell, so just close your eyes and let me know what you smell.
Coffee.
Perfect, you can open your eyes. And I'm going to let you close each nostril and sniff. Nares are patent, and then palpating the frontal and maxillary sinuses for any tenderness there. Perfect. I'm then going to move on to her mouth, and I'm just going to let you open your mouth. I'm looking at her teeth, her lips, her gum, buccal mucosa, her posterior pharynx, salivary ducts. I'm going to look at the top of her mouth, the roof, underneath your tongue. Perfect. And then I'm going to let you stick out your tongue and say, ah. Cranial nerve 9 and 10 as the uvula and soft palate rises symmetrically with phonation, and then sticking out your tongue again. Cranial nerve number 12 as the tongue is midline without fasciculations. I'm then going to move on to her neck, palpating the trachea. That is midline. I'm going to palpate the carotid artery one at a time. And then I'm going to auscultate to listen for any bruits. And I'm going to get behind you and just have you look straight and swallow to assess your thyroid. Very good. Okay, I'm then gonna have you turn, and we're just gonna start by looking at her posterior chest. I'm first just looking for any signs of respiratory distress, any signs, use of accessory muscles, nasal flaring, tripod positioning, tachypnea, cyanosis. I don't see any of that. I see no deformities. Everything looks good and symmetric. I'm going to assess for chest expansion symmetrically in and out. Good. And tactile from tight symmetrically. Just 99.
99.
And again 99.
99.
Perfect. I am then going to percuss in the lung fields. And auscultate. Just take a breath when you feel my stethoscope. Making sure I get our lateral lung fields. Very good. And then I'm going to test for agophony, bronchophony, and whisper rectally. So first, just start by saying 99 when you feel this.
99. 99. 99. 99. 99. 99. 99. 99.
Good. And then if you could say E when you feel it.
E. 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 E.
And then whispering 1, 2, 3. Very good. Okay, and then I'm gonna let you turn to the front. And we are then again just looking at her anterior chest again for any signs of respiratory distress, any signs of use of accessory muscles, tripod positioning, nasal flaring, tachypnea, cyanosis, which I see none of. I see no deformities. Everything looks good and symmetric. I'm going to assess for symmetric chest expansion, breathing in and out. Good. And tactile dermatitis, say 99.
99.
Good. And I'm going to auscultate again. Could just take some deep breaths for me. Very good. And then going to move on to her heart, going to listen to both the bell and the diaphragm. So in the aortic, pulmonic, Erb's point, tricuspid, and mitral. And then the aortic, pulmonic, Erb's point, tricuspid, and mitral. Then going to palpate and locate the PMI. It is non-displaced. And I'm going to listen for a full minute. It is a regular rate and rhythm at 75. Very good. And I'm going to have you lay down with your head at a 30 to 45 degree angle. And I'm going to let you look this way and then back towards me. I'm looking for any jugular vein distension, any pulsation, which I'm not seeing any of. I'm then going to look for any, here I'm again looking for any heaves or lifts. I'm going to palpate in the aortic, pulmonic, Erb's point, tricuspid, and mitral. And again, auscultating with the bell and the diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral. And moving on to her abdomen, get you lift your shirt up. I'm first just looking for contour symmetry. It is round and flat. I'm going to start by auscultating for any bruits at the aorta, renal, iliac, and femoral arteries, as well as listening in all four quadrants to your bowel sounds that are normoactive. Good. I'm then going to percuss, looking for any Tiffany, flatness and dullness, and palpating for any masses or tenderness, and then palpating the liver and spleen. So just take a deep breath in, and then the spleen. Very good. Then I'll let you sit up and assess, assessing for any CVA tenderness. So just let me know if you feel any tenderness.
No.
Perfect. And I'm gonna let you turn this way. And I'm moving now on to musculoskeletal. So I'm just gonna start by assessing the joints of her hands, fingers, wrists, elbows, and shoulders. And I'm gonna go ahead and do the joints of her feet and toes and her ankles, knees and hips. Assessing all of those for symmetry, redness, swelling, nodules, crepitus, tenderness. I don't see any edema anywhere. Assessing the skin overall for any of that. I'm going to assess the capillary refill in your fingers, which is less than 3 seconds. And your radial pulses. Good. And I'm going to let you squeeze my fingers. And her grip strength is a 5 out of 5. And then your bicep and tricep strength, so just push and then pull, 5 out of 5. And then your shoulders So push out, in, and then cranial nerve number 11. If you could shrug up against my my hands, good job, sorry. And then next gonna have you do cerebellar coordination. So hands on your knees and just flip flop them. And then finger opposition, and then finger to finger. So touching your nose and then my finger. Very good. And then we're gonna do stereogenesis and graph. So if you could close your eyes, hold your hands out. Tell me what you feel in this hand.
Key.
And then in this one,
Q-tip.
good. And then I'm just gonna write something and let me know what you feel. A letter.
A.
Good.
B.
Very good. Okay, and next we're gonna do range of motion. So we're gonna start with your fingers. So we're going to do extension, flexion, and then we're gonna do abduction and adduction, and then thumb opposition, and then hyperextension. And then with our wrist, we're gonna do flexion, extension, hyperextension, ulnar deviation, and then we're gonna do rotation. And then with your elbows, we're gonna do flexion, extension, and hyperextension. And then your shoulders, we're gonna do flexion, extension, hyperextension, and then we're gonna do adduction and abduction, and then circumduction, and then hyperextension, and then internal rotation and external rotation. You're fine. It's hard to do sitting down. Very good. And then we are going to move on to your we're going to do deep tendon reflexes. So we're going to do brachioradialis. And then we're going to do biceps and triceps. And patellar. Achilles, and Binsky, and we are also going to do strike this, and I'm going to put it here, and we're going to test for vibratory sensation. So let me know if you feel it.
Yes. Yes.
And on your lower extremities as well.
Yes. Yes.
Very good. And now moving on to your lower extremities, just assessing the capillary refill in your toes. Less than 3 seconds. Dorsal pedis pulses, less than 3 seconds. Posterior tibial pulses are palpable. And then I'm going to get you to flex and pull. Good. And just testing your strength. Good. 5 out of 5 strength there. And then in your hips, if you could push against me, pull in, 5 out of 5 strength in all of her lower extremities. And then we're going to do range of motion of your toes. So we're gonna do extension, flexion, and then we're gonna do abduction and adduction and hyperextension, good. And then with your ankles, so we're gonna do flexion, extension, hyperextension, and then inversion, eversion, and rotation. Good. And then I'm going to let you then stand up. And we're going to do range of motion of your knees. So extension and then flexion. Good. And hyperextension. Very good. And then we're going to do your hips. So we're going to first do extension, hyperextension back. And then we're gonna do abduction and adduction, and then external rotation and internal rotation, and then circumduction, little circles. Very good. And then we're gonna do range of motion of your cervical. So we're gonna do flexion, extension, hyperextension, lateral, and then rotation. And then we're gonna do lower, so we're gonna do extension, flexion, and then hyperextension, again lateral and rotation. Very good. And then I'm gonna let you turn this way. I'm gonna let you bend over. This way, sorry. Assessing your spine. I'm looking for any scoliosis, which is not apparent. I'm looking at the curvature of your spine. I see no deformities, no abnormalities here. I'm gonna let you stand back up. I'm going to let you walk regularly this way and then walk back towards me tandem with your toe. There you go, perfect. And then we're going to turn this way and do Romberg. Oh, yeah, you're fine. And just feet together, hands by your side, eyes closed. I see no swaying. Balance is great. And then you can open your eyes and hop on one leg. Perfect, and the other. And that completes our head to toe assessment. Thank you.